So let's see here. Amelie, Dr. Osborne, my dad had his thyroid gland removed due to nodules and overgrowth, and has to take tyrosine. Are you sure that's not thyroxine that you meant to say there? What could be the cause? Gluten? What should he get checked for, and things he should be careful of? Yeah, I mean, it's very possible. If anybody who's got thyroid nodules, can gluten cause thyroid nodules? Absolutely, it can. So that would always be at the top of our list of suspicions for somebody who had a thyroid nodule problem. So definitely your dad should have proper testing done to identify whether or not he needs to go on a gluten-free diet, because just because they removed the gland and he's got to take the medicine now because the gland has been removed doesn't mean gluten's not hurting him in other ways. I just showed you a lot of scary ways that gluten can create damage for people. So definitely get him and get him the information on proper testing. And if his doctor's not willing to test him, look, send him to Gluten Free Society. We do genetic testing. I'll put a link up in the feed for you, Emil, for genetic testing. You don't need a doctor's note for it, and it can give you the answer. It can help your father get the answer that he needs. Let's see here. I like that. Vampires are macrobiotic paleo. Yes, they sure are. Keep the Halloween jokes coming, folks. Will gamma globulin infusions for immune deficiency be safe for a gluten-sensitive person? You know, the therapy itself is relatively safe. Some of the biggest things I've seen in patients that have had those infusions is anaphylactic reactions where they become, where they break out in hives after the infusions. And a lot of times when you get those types of infusions and you're doing it in a hospital setting or in an inpatient setting, is they'll give you things like Benadryl. They'll also give you medications, other anti-inflammatory medications to suppress that type of reaction. So the best thing to know whether it's safe is to just talk with the doctor who's treating you and get the risk benefit of it. But those are some of the things I've seen with people. I've seen people with gamma globulin deficiency actually recover going gluten-free. So that's something else that you should know, that a lot of times what happens when people become antibody deficient over time and develop these low antibody levels, it's because their body is being so worked over by gluten exposure. The body's doing everything it can, the immune system's doing everything it can to produce antibodies to defend you from the gluten, and that's why you're not making adequate quantities of antibodies overall. Your levels can start to drop. So sometimes for some people, going gluten-free resolves that issue. It can take, in my experience, it can take about 18 months or longer, but I've seen it happen and be the case. Will someone become gluten sensitive if they drink or eat after someone who is gluten sensitive? No, I don't think it works that way. Good question, Jose, but I don't think it works that way. It's not contagious. So we'll just say gluten sensitivity is not spread to other people through a contagion. Although we can say this, I say it's a good question, but here's what we do know, Jose, that infection. Oops, we're in white. Let's get a different color up. And infections are linked. So chronic infection are linked to an increased or an accelerated, if you will, gluten reaction. So again, you could be gluten sensitive, and what we see sometimes happen is persons eating gluten, they're not really reacting to gluten outwardly. There's no great symptoms, and then they get an infection, and after that infection, bam, every time they eat gluten, the symptoms are heightened. They have an increase in symptoms. That's because that infection is like the tipping point. It's like the proverbial straw that breaks the camel's back. It's the thing that toppled the immune system, and now that when you eat that gluten, you become much more aware of it. We see this very common as a trigger. We know that infections can do it, antibiotics can do the same thing. Certain anti-acid medications can trigger the gluten reactions to come on more strongly. Antihistamines can do it. Certain blood pressure medications can do it. So a lot of commonly prescribed medicines can do it, and infection can do it. So although you can't catch gluten sensitivity by eating or drinking after somebody else, if somebody else is infected and you get infected and you're already gluten sensitive, that gluten reaction might show up a little bit more aggressively thereafter. Let's see, how about, how many people are continuing to eat grains not realizing that they're slowly poisoning themselves? Well, here's what we know. About 40%, we estimate that about 40% of the population is gluten sensitive. Now, and this number comes from several of my colleagues and myself, our own internal numbers, but most research is certain that 1% of the U.S. and industrialized countries have celiac disease, which is a manifestation of gluten, right? So all people with celiac disease are gluten sensitive, but not everybody with gluten sensitivity will go on to develop celiac disease. But we know that 1% of the population has celiac disease. We are fairly certain that 6% of the U.S. population has non-celiac gluten sensitivity. So are 6% of the people in the U.S. gluten-free? I highly doubt it. We're probably closer to 2%, 3%, somewhere in that neighborhood, but nowhere near 6. So many people are eating gluten not knowing that they're damaging themselves over time. And it's not until they really get sick that they seek out an answer for their illness that they actually get this type of diagnosis. Remember, 30 years is the average time to diagnosis. So 30 years is the average time that it takes for a person who has an issue with gluten to actually get a diagnosis. Now, if you get one early, like in childhood, like a pediatric diagnosis, I would consider you to be a very fortunate person. Yeah, I like this question. Never too much. If you go gluten-free, then eat gluten again. So you go gluten-free for a time, then you start eating gluten again. Can you develop symptoms that you've never experienced before? Yes. It's one of the ways your body's so brilliant and it's so intelligent. It's one of the ways your body screams at you. It's almost like your body is slapping you in the face and saying, wake up, don't do this again. We weren't getting poisoned and now you're going to do it again. We're going to give you something new and more potent to think about. So it's definitely a possibility. Let's see here. If you don't have HLA-DQ2 or 8, is it fine to eat gluten or are there other genes to look at? There are other genes to look at. And I've talked about this a number of times. And many of you that go and do like these 23andMe tests online, look, they're fine tests. They pick up a lot of different genetic material, although I will tell you they're stealing your data and selling it to pharmaceutical companies. So if you don't like to support that, I would have you ask whether or not that's something you want your DNA data to be something you want your DNA to be shared with pharma. That being said, there are other gluten genes. You can get tested through Gluten-Free Society. We do not share your data with absolutely anyone. And we test for more than just the DQ2 and the DQ8. How long do gluten symptoms last after going gluten-free? Can some symptoms return while detoxifying or detoxing? Yes, they can, Angela. So how long do symptoms last? I've seen people have improvement within a matter of days. I've seen people have an improvement within a matter of months. It depends on the individual and it depends on what else is going on, because sometimes it's gluten, although gluten can cause a lot of problems, by the time most people recognize they need to change their diet, not only are they gluten sensitive, but maybe they have some other food allergies. Maybe they also have nutritional deficits that are linked to some of the symptoms. Maybe they have other things that they're not doing well. And so their disease or their problems are more than one facet. It's not just gluten per se. So going gluten-free sometimes isn't enough for many people, and it's because you may be missing some other things that you have to do in conjunction with going gluten-free. So hopefully that's helpful for you. So don't lose heart, Julie. Julie says it's frustrating and causes so much food fear. It's not about food fear. It's about education. When you know, you can empower yourself to make the right changes. When you're just learning about this and you're like, oh no rice, no corn, no milk, I'm headed for the grave. No, you're headed for the grave if you keep eating those things. You're headed for a life of abundance and symptom-free and disease-free when you start changing your diet. But that learning curve is very scary, and it's very frustrating, because if you're used to eating, rice and corn as staple foods in your diet, you've got to find other healthy things that you can supplant those with, and that's really, it's that learning curve. Remember, all people fear change, and that's, you mourn food and then you fear change. And so the first step is to mourn the food, like mourn its loss. Go through the process of anger and denial and grief and depression and bargaining, but you'll come to acceptance. And once you get there, you can go through the learning curve and really graduate to much higher health. So don't lose heart. Let's see here. So Elaine says, greetings from chilly, moldy Illinois. My fall allergies are awful right now. Quercetin, zinc, vitamin C aren't helping enough. Any tips? Elaine, I have a formula called HistoSyst that you might want to check out. HistoSyst it has some of those ingredients like the C and the quercetin. It has bromelain and nettle and some other things in it that can help. They all work as what's called mast cell stabilizers. Mast cells are the cells that release all those chemicals that give us the symptoms of allergies, the watery, teary, itchy eyes, runny nose, that type of stuff. And so when you can take nutraceutical that help to stabilize mast cell membranes, a lot of times when you're exposed to allergens, you don't get quite the release, so you can get some relief from that. So that would be something I would highly recommend that you try if taking the C and the zinc and the quercetin individually together are not doing the trick. Let's see here. Go down. Oh, did I miss something? Oh, they have. Yeah, go down on the right. Starch. You mentioned rice starch. What about other starches like potato? So potato is gluten-free. Now, you might have a problem with starches for a completely different reason, but when talking about the medications, the potato starch is gluten and grain-free, so perfectly fine. The quantity that they would be using in that is not really going to be calorically of a high glycemic load, so it's not going to send you into a sugar rush, or at least it shouldn't. But yeah, if it's potato starch, it's fine. So Gwen says, had inadvertent small exposure to gluten last weekend after being strictly grain-free for several months. What should you do in that situation? My favorite thing to do to recover from a gluten exposure is vitamin C. Like, hands down, vitamin C, maybe you've heard me mention this, but vitamin C is like human duct tape. It just does everything so well. It's just such a powerful nutrient. But what I encourage is something called a vitamin C flush. Now, there are a couple things that you have to be aware of with a vitamin C flush. Number one is make sure that the vitamin C that you're using is corn and grain free. Most vitamin C's on the market, like if you're buying some of these more popular brands, I can promise you they're made from genetically modified corn. If you want a good one that's not, use our Detox C. That's why I formulated it. It's so we could get a really good source and powdered source of vitamin C that's buffered with minerals. That's the other thing. With vitamin C flush, when you're using vitamin C, you want to make sure that the vitamin C is buffered. If it's not buffered, you can have a lot of gastrointestinal symptoms kind of manifest as a result of that. So you want to make sure it's buffered with minerals. And we use copper and magnesium and zinc and copper to bind and buffer our vitamin C. And so that's one. And so the way this is done is a flush is done first thing in the morning, empty stomach. You're planning the day around the flush. So you want to say no plans, don't have any plans, because you're going to be finding the toilet for the next few hours. Number three, you start off with, depending on your health, if you're kind of a sickly person, you start off with 2 teaspoons. if you're in good health, you start off with 1 teaspoon. And you do this, you take it in about 3 ounces of water every 15 minutes. Okay, same thing down here. So you start with either 1 or 2 teaspoons every 15 minutes. You're going to take that vitamin C mixed in 3 ounces of water. And you're going to do that until your bowels start moving, until you start having basically until you find yourself needing to go to the bathroom and your bowels are starting to move. And once you hit the point of diarrhea, so you do this every 15 minutes until you hit diarrhea. Once you hit diarrhea, you stop taking the C. You're done. That's what the flush is you're flushing out your bowel. And when you flush out your bowel after a gluten exposure, there's some research too that shows that after gluten exposure, vitamin C is necessary to heal the intestinal inflammation. So this is one of the reasons why I like vitamin C for this, but it's my favorite thing to do if you're going to, if you're finding yourself getting gluten. It's my favorite way to make an expedient recovery. Now, the other thing I would suggest that you do, if you're eating somebody else's food, we call that around here, we call that OPF, other people's food, and you're not sure whether or not you might be gluten, best thing to do is just not eat it. But if you're eating out, you're traveling, and you're not quite sure, but you're being as careful as you can be, take something like Gluten Shield, our digestive enzyme formula designed to bust gluten proteins up so that they're less damaging and detrimental if you did get exposure to them. Now, you should never use Gluten Shield as an excuse to eat a bowl of spaghetti or pasta or something like that, but you can use it as a digestive aid and as a preventative to minimize any kind of gluten exposure when you are eating out or traveling. Can receiving a blood transfusion from someone who eats gluten affect someone who has celiac disease? That's a fantastic question, and the answer is we don't know. I have not seen any research studies, actually studying that as a parameter. So, the answer is we don't know. We could speculate, but I'm not one to try to speculate. I would say if you're in the need of a blood transfusion, I'd rather you do the transfusion and get your life saved than to worry about whether or not you might get some kind of gluten exposure from that transfusion. Now, if you've got somebody who's willing to donate the blood and they eat gluten-free, more power to you. I think that's not a bad idea. Does gluten play a role in interstitial lung disease? Yes, I've seen people with interstitial lung issues do very, very well and improve on gluten-free diets. So yes, in my experience, Mary, that is definitely something that I've seen play or be a connection. Vitamin C, yeah, okay, read that. So Julie says, why do I get mouth ulcers when I take vitamin C and lemons? So you might have a citrus reaction. Some people, there are a number of different reasons why. Some people are allergic to lemons, and that could be a cause. But other times, when people are struggling, the mucosal lining inside the mouth, inside the esophagus, and the stomach are a little bit stripped away. They're not what they should be, and so there can be some things that a person needs to do to recover that mucosal lining. One of the things is glutamine. L-glutamine is a fantastic supplement to help support the recovery of the linings, of those mucosal linings that we know gluten can damage. Probiotics can also help support the proper recovery of the lining. And then there are certain products, especially if you're new to the gluten-free diet and you struggle with this type of problem, there are certain mucilaginous products like marshmallow and aloe vera that can help act as a surrogate coating as you're making that transition. But it's possible that you're allergic, and it's also possible that your lining is stripped away, and so you're reacting. And so that's one of the reasons why I said with the vitamin C, you want to make sure that it's buffered, and because if it's not buffered, it has a tendency to create irritation to those that have a problem with mouth ulceration or mouth ulcers. Is there a way to cure or improve tinnitus? Yes, there is, depending on what causes it. Now, if you've got inner ear damage, it's from a traumatic brain injury or traumatic head injury, we might have a different discussion, but gluten is one of the triggers for tinnitus. Parasites can cause tinnitus. There are a number of different things that actually can trigger it. So the answer to your question is yes, there is a way to improve it. And in some cases, I've seen it go away. Let's see, is it possible to have an appointment with you? Yes, it's simple. Call my office. My office number is 281-240-2229, or you can visit drdrpeterosborne.com, and there's a little box at the top that says consult, and you just click on that and connect with my office. Do I have information on severe psoriasis? It's funny, I just did I just did an entire master class on gluten and skin disorders. So psoriasis, eczema, and some of the others, and atopic dermatitis. And that was done, and it was in a summit that was hosted by a good friend of mine. But that summit I think it's passed. It was actually, you would have had free access to it. We're actually getting ready to take that information and that material and add it to glutenology, which is our master class. We're going to add it to our library. We're adding a lot of new videos to that glutenology masterclass library over the next 6 months or so, and skin disorders one of those. You might check out my YouTube channel as well, and just do a search for skin or psoriasis and see. I think we have some videos on skin health in there that you might access right away. Let's see, are potatoes hard to digest? You know, if you eat them raw, they certainly are. I think that's where some people get in trouble. They don't cook them well enough. Potatoes need to be cooked down and soft, because a lot of the bonds in potatoes can be extremely challenging to digest, especially in those with a history of gluten where they're already struggling with digestion. Do eggs, dark chocolate, coconut cause or contribute to constipation? It depends. Eggs, I've seen eggs be able to contribute to constipation in people that have stomach acid deficit, because protein can be harder to digest. And so in that regard, caffeine definitely from the dark chocolate can interfere with motility of the gut and can contribute to problems. And coconut, I've not really ever seen too much constipation with just eating coconut. But the other two, there's a possibility. Now, you can also be allergic to coconut, in which case it can cause inflammation in the gut, and that can sometimes lead to a slower motility time. So it is a possibility. What about stress and gluten? So I think Maria is asking, because I was talking about earlier about drugs and certain medicines being able to trigger a greater reactivity to gluten, and so can stress do it as well? Absolutely it can. And Maria, I'm sorry that you lost your dog. I also lost my dog about 6 months ago. We lost our family Yorkie. So I definitely, my heart goes out to you. I know that's a tough one. But yes, stress can absolutely, stress causes leaky gut. I mean, in a nutshell, and chronic stress keeps your gut leaking. So stress can definitely create issues there. Sister developed POTS after getting poked on disability. What supplements can I recommend to help her? So I actually have a couple of good videos on POTS. That's postural orthostatic tachycardia. B12 is probably one of the things that has been shown in some of the research to be helpful in people with POTS. Gluten-free diet's extremely helpful. But go check it out. I've got some videos on our YouTube channel that you can read and maybe forward or watch and forward her way. I've had an endoscopy and they said I do not have celiac disease, but every time I stop eating gluten, I don't get spots on my foot anymore. Could you please tell me what's going on? Yeah, you're gluten sensitive. Your body's trying to talk to you. Here's the thing, folks. I don't care what a doctor ever tells you. If you eat a food and you have a negative reaction to that food, doesn't matter what test that you had done that tells you that you should or shouldn't, you listen to your body. Your body is your doctor. Your body's trying to doctor you, and if you will just listen. A lot of times people dismiss what their body's trying to tell them in lieu of a doctor who isn't living inside of your body, doesn't experience what you experience, doesn't understand your symptoms or your life. You know, it's not like the doctor can jump on a little microcraft in your bloodstream and understand everything that goes on in the day of your life, right? So a lot of times doctors and the tests that doctors run are not definitive. So don't, listen to your body, because your body is definitive. When your body's talking to you, don't ignore it. Flaky rash above my eyebrows. I can't figure out what's triggering it. You need to get tested. I mean, Dahlia, you've had a lot of questions tonight. I've gone through several of them. You need to get tested. You need to get tested for nutritional deficiencies, food sensitivity, microbial imbalance. You need to get with somebody who can do the right kind of testing to help you figure this out. Because if you're getting a rash, imagine that's inflammation on your skin. Imagine what's going on internally. I mean, if you can see it outwardly, you know it's happening internally, and that's the whole thing. Let's see here. Eliana is asking, can candida overgrowth lead to gluten sensitivity? This is a great question. Yeah, the answer is it can. And here's how. Specifically candida. So candida albicans, one of the more common fungus or yeast that inhabit the GI tract, but they produce something called HWP1, hyphal wall protein 1. This is a protein that acts like a finger. It's a finger protein that on the surface of candida that it's used to bind candida. It uses it to grab onto things. So it holds on to you, right? It binds to your gut, to the gut wall, so that you can't poop it out. And that's how, and then it replicates, right? And when it replicates, now you get candida overgrowth. And the way people get candida overgrowth, because remember, candida is not necessarily 100% evil or bad. Everybody's going to have some small degree. It's when the population goes up. Well, how do we have a population of candida go up? We eat sugar. We drink alcohol. We excessively consume too many carbs. And carbohydrates break down into sugar. So remember, how do we make wine? We take yeast and we take sugar, right? And we mix it together. We get alcohol. So this is one of the problems: is when you give candida, or when you give candida sugar, you get wine, and you get it in your gut. There's a name for this. It's called autobrewery. So you actually your gut becomes a wine factory. And here's the thing, going back to this: the more candida you feed, the more HWP, the more hyphal wall proteins you make. Hyphal wall proteins have homology or sameness with gluten, meaning they can trigger a gluten response. So if you're gluten-free and you're gluten sensitive, but you have a candida overgrowth, your body can start behaving as if you're getting exposure to gluten because of the hyphal wall protein production acceleration that goes on with a candida overgrowth. So yes, candida can trigger a gluten-like response. Now, candida can also, in and of itself, by its own right, damage your GI tract and make you more susceptible to reacting to gluten as well. So there's the mimicry of gluten, but then there's also the fact that it can accelerate your reactivity to gluten. Let's see here. How do you get tested? Salita asks, how do you get tested for gluten? Salita, the quickest, easiest, most accurate way to get tested is genetic testing. I don't know if we pumped that into the feed already for you, but look in the feed. I think my team has put up a link for you to read more and learn more about genetic testing for gluten sensitivity. Hands down, the best way to help you determine that. Do we need to avoid iodized salt as it contains dextrose? There are tons of foods that contain salt. Yeah, I mean, I don't really recommend this traditional table salt that's iodized. I mean, I understand why it's iodized, but I don't like the fact that it's got dextrose and other chemicals in it that you really don't want to expose yourself to. So it's better to eat like a natural sea salt or a Himalayan type of salt. But if you do that, make sure you get enough iodine in your diet, either through eating seafood from the ocean, like fish, or eating things like kelp or seaweed. If you're allergic to wheat, can you also be sensitive to gluten? Yeah, absolutely. They're not the same thing, Amy. They're two very different things, gluten allergy, or rather wheat allergy versus gluten sensitivity, but you can have both. It's very possible. Does gluten add to diarrhea, which only happens once or twice in the morning? Yes, it can. Gluten can definitely cause diarrhea. Remember, the hallmark classic symptom of celiac disease is diarrhea, but then that gluten can also contribute to IBS type D, which is a type of irritable bowel syndrome that creates diarrhea. I do not miss grains or dairy at all because it really lowered my quality of life. Now I just have to find a non-water damaged place to live that I can afford and isn't too big to dust and clean daily. You know, I'm just going to throw this out there, Elaine. You know, tent living, not that you want to live in a tent or anybody should live in a tent, but if you're looking and you don't have, if you're in a moldy place and the moldy place is destroying your health, and if you've got a backyard, I've had people, you know, where we've been, you know, we were in a rock and a hard spot trying to figure out how to get them out of their moldy environment, who actually lived in a tent in their backyard and started to do much, much better as they were going through the transition of finding another place. So not to tell you need to go live in a tent, but it's just something you can consider. Can someone only be only sensitive to the wheat gluten but not the rice gluten? No, if you're gluten sensitive, you're pretty much gluten sensitive. The proteins, the gluten proteins are all so similar that I don't recommend cross-reacting them. Oh, so Bobby says, help. Any advice on motivating kids to eat healthy? Have a teen not willing to eat healthy outside the home. I give them high doses of vitamin C, omega-3s, multivitamin. Scared mom. Yeah, that's just it, Bobby. You know, I get it. I've raised children of my own, and struggled in some ways to really get them to understand and to really follow through with the tenets of good health. There's such a social pressure. There's such a social paradigm to eat poorly, and it's normalized, right? Today we normalize garbage as good food, right? We normalize, you know, fake food as real food. We normalize, you know, so many things in our society are normalized that shouldn't be, and that's just it. You have to. What sounds like what you've done is you've given your child the knowledge, and you lead by example, and you feed by example at home. And unfortunately, sometimes what has to happen is your child has to figure that out. They have to either feel ill enough that they recognize when they're eating outside of the home that their health deteriorates, and that they're willing to make that effort. Because once they're teenagers, you know, they will make their own decisions. And so it just depends on, you know, how you've reared them and how you've taught them and the foundation that you've given them. I can just say, like, for example, my oldest son, when he first went off to college that first year, I'm very certain he ate gluten and that he did things that I would not have approved of particularly, but he paid a price. He paid a price in his health, and it made his life different because he got to a point where he realized it, because he had the foundation. Had he not had that good foundation, he would have never known what it was like to feel healthy without that foundation. But when he started feeling unhealthy, moving away from that foundation, he was able and intelligent enough to kind of gravitate back, and now he cooks all his own meals. I mean, he's a young man at 28 today, but he cooks all his own meals, he makes all his own food, and he makes sure that his food is organic. I mean, he prioritizes that the right way because of that experience. A lot of questions about liposomal C. The biggest issue I have with most of the liposomal C products is that the liposome is corn derived. And so I don't like them for that reason. And if we can find one that or find somebody willing to help put together a liposome that is not corn derivative, I would say that isn't a bad option. I still prefer pure L-ascorbic acid as a version of vitamin C. Clinically speaking, it's just such a wonderful thing that you can take, and very, very powerful, even over the liposomal. Let's see, is it okay to take melatonin if you're going gluten-free? Sure, just make sure that the version of melatonin that you're taking, Michael, is a gluten-free version. I love that. Michael says, fellow gluten-free warrior here, I wear my shirt just to keep myself in check. I love that, man. You gotta take a picture of that and hashtag save 100 million lives and hashtag gluten-free warrior and share that on the social media channels and tag me in it. Love that, love that. And those of you who don't have a gluten-free warrior shirt, we give those out from time to time to the people that show just how much of a gluten-free warrior they are. So we reward folks in our community with those. So you may see those floating around and about out there. Scroll down on the right. Oh, I'm sorry. Go back up. Yeah, a little right there. What? Okay, so Penny's asking what can one take for diarrhea? Google says the Brat diet: bananas, rice, apples, and toast. That's a classic one, or the Bart diet is the way you've got it spelled there. But if you've got chronic diarrhea, taking any amount of Brat diet, I mean, there's rice in it and there's toast in it. So if your diarrhea is caused by gluten, you're doomed to failure on that diet. Penny, the real answer there is figure out what's causing the diarrhea. And for most people, food sensitivity, food allergy, lack of diverse microbiome, these are all common things that can cause diarrhea. But the best thing to do is to figure it out and figure it out. And you may pay attention yourself and not be able to figure out, in which case I'd recommend you get with a good functional doctor to help you figure it out. Can the skin disease be linked to gluten? I think we had that question earlier, and the answer is absolutely yes. How often should you have a follow-up? I have only 1 in 6 years. A follow-up for what? A follow-up for like a GP, like an office visit for a physical examination? It depends on your health. It depends on the state of your health. It depends on your risk factors. It depends on a lot of different factors. I don't think there's a one size fits all answer for that question. Go back up just a little bit on that right side. Let's see, is having tuna fish good? Yeah, I mean, it's fine. Tuna fish is fine. You do have to be careful that some of the tuna contains mercury, so you got to be careful of quantity with tuna. I don't recommend making it the primary staple in your diet because of the mercury contamination. But having tuna, once a week or so I would say, be perfectly fine. Shelley's asking, can an elevated lipase level be caused from gluten? It can. So an elevated lipase, for those of you that don't know, lipase is a pancreatic enzyme, and elevations are a sign of pancreatitis, which is pancreatic inflammation. And so gluten is definitely been linked to pancreatitis. Actually, one time I had a patient come in, pancreatic enzyme levels were in the thousands. I mean, well up over 20,000. Very severely so, and a gluten-free diet brought them back down to complete normal. So you gotta understand gluten can definitely contribute to pancreatitis in that way. Is a low FODMAP bone broth diet the best way to heal the gut? Not necessarily. Look, low FODMAP is a good place to start, possibly. But my experience is FODMAP is a lot of different types of foods. And not all people have to avoid all FODMAPs. It's part of where testing can be very valuable. A lot of people say, hey, Dr. Osborne, how do we heal a leaky gut? There are certain fundamental things you can do, like only eat real food, make sure you're being exposed outside to bacteria, don't be a germaphobe, that you get adequate sleep, I recommend a good multivitamin, I recommend a good probiotic for people struggling with leaky gut. Sometimes I recommend digestive enzymes, depending, but it also depends on why you have a leaky gut. And sometimes the foods on a low FODMAP diet are good, but you may be missing something. For example, I've seen patients where broccoli or blueberries or even fish, codfish, was causing their leaky gut and their problems. So, a low FODMAP diet wouldn't necessarily 100% help those individuals. So again, it's a good place to maybe think about starting, but it's not the end all be all. And I know that the problem with any diet, including mine, including the no grain, no pain diet, is that generically speaking, it's a generic diet. It's not specified for the individual. And ultimately, if any of you that are listening to this, if you're still struggling and you've been trying to do it yourself and you've been trying to follow and get advice online from a lot of different health practitioners and just trying to learn and educate yourself, I give you 5 stars for that, because most people don't even look. Most people don't even take the time to educate themselves. But sometimes you get to a roadblock or to a point where it's time to bring a professional in. It's kind of like if my toilet is busted and leaking all over my house, I'm not going to try to become a plumber. I'm going to call a plumber or somebody I need to bring in right away to get that problem fixed. Remember, the toilet is less important than your health, right? So sometimes people get to that point. I would recommend that you seek out professional help to get these things taken care of. Is SIBO linked to gluten? It can be. There are lots of different things that can contribute to SIBO, but gluten is definitely one of them. Are mold allergies caused by gluten? Can be. Mold allergies can also just be there. Let's see. Does fake meat contain gluten? Well, I would just say this, whether it contained gluten or not, I wouldn't eat it. It's fake meat. It's junk. It's garbage. It's not real food. All these Impossible burgers and all this other nonsense that's being pumped out, why do you think that stuff's being pumped out? It's basically low protein plant gruel designed to make you sick so that you can't think for yourself, so that you can't be educated, so that your health is deteriorated, so that your immune system tanks. That food is junk, and whoever's selling it is making massive amounts of profit off the cheapest growth of genetically modified nonsense. So, yeah, don't eat it. Is amaranth plant like the leaf? I'm not sure I understand your question. Is amaranth plant like the leaf be eating? Maybe reword that for me. Have celiac. If I kiss someone who is drinking beer, can it cause a reaction? Yes, it can. Watch out who you kiss when you are gluten sensitive, because that is one way you can get cross-reactivity, especially open mouth kisses. I'm gluten intolerant and gluten free. I can't keep my iron up. I feel like crap as soon as I stop my iron tablets, but I'm scared to damage my liver with so much iron. What can I do? You need to get help, Sandstorm. You need to get help. It's not something you should be on a do-it-yourself plan for. Get in the hands of a competent functional practitioner who can give you greater degrees of parameters to understand why you're still malabsorbing iron, because there could be something else going on. Even though you're gluten-free, there's something called refractory disease, which is where you do go gluten-free, but you don't heal and you don't get better. And that actually can contribute to one of the things we were talking about tonight, those lymphomas that can kill you. And so you want to get that looked at. You want to have that looked at quicker rather than later, so that you can get to the bottom of it. But I've never seen a case of refractory iron deficiency where it couldn't be corrected. So yours can be corrected. You just have to get it figured out, but you don't want to mess around with it. Can endometriosis and cystic acne stem from gluten? It can, but gluten is not the only cause of those things. Can thyroid nodules? I think I answered that earlier. Yes, thyroid nodules can be linked to gluten sensitivity. Hello from Virginia. I have osteoporosis. Can this be related to gluten? Yes, osteoporosis is recently identified as an autoimmune condition. There's actually a gluten can trigger the degradation, the autoimmune degradation of your bone. That's why people, especially early, like in their 40s and 50s, that get severe osteoporosis, oftentimes our celiacs are gluten sensitive individuals because they've developed an osteoporosis that's autoimmune in nature, where their immune system is chewing through the bone. Can bone broth cause problems with hypothyroidism? When I drink chicken or bone broth, I don't feel well. Yeah, so probably not necessarily that it's causing problems with the hypothyroid, but chicken broth and beef broth, bone broths in general, for some people, are super hard to digest. They're thick and full of proline and lysine, amino acids that can be really challenging to break down. Some people don't do well with bone broth. And I know that's a lot of what we hear, online, what you may hear in different classes. Oh, bone broth is a miracle food. Look, one man's food is another man's poison, and bone broth doesn't fix everybody's leaky gut. It helps dramatically with some people, but it really wreaks havoc on other people. So if you're finding that you don't do well with it, I would say listen to your body. I was taking vitamin C, my detox C, but my calcium is borderline high. Is it still okay to take? Yeah, it's absolutely okay to take vitamin C. Vitamin C doesn't cause an elevation in calcium, and there's a little bit of calcium in our vitamin C, our detox C, but not enough that it's going to create an issue. And if your vitamin C or if your calcium is elevated, probably doesn't have to do with the fact that you have high calcium as much as it may have to do with the fact that you have a vitamin D deficiency. It's very common for those with vitamin D deficiencies where their blood serum calcium levels will go up, because their parathyroid, when your vitamin D levels are low, your parathyroid will wake up and it will tell your bone to release calcium. Calcium has to be maintained in the blood level, and if it drops too low, you can actually die. You can have a heart attack. So your body's really smart, and it will pull calcium out of the greatest calcium storehouse, which is your bone, under the auspice of parathyroid hormone's direction when you don't have adequate vitamin D. So another thing that I would encourage you to do is get with your doctor and ask them to check your 25-OH-D levels and make sure that vitamin D is not problematic. Let's see. I become super healthy once I went grain, egg, dairy, pork, nightshade, poultry, and flax free. I don't catch colds or flus anymore. I have lots of energy, eat grass-fed meat and organic fruits and vegetables. High five to you, Sarah. Great job. I'm glad you found the answers to restore your health. Is it just a myth that high-dose vitamin C can cause calcium oxalate stones? Yeah, it's not a myth, but it's super rare. I mean, I get this all the time because we check and people that come to see me, oxalate is something I check on a regular basis. But vitamin C, there's some very small, poorly done studies that made an association between vitamin C and calcium oxalate stones or kidney stones. I have not seen this be true clinically, where people have had a history of stones, for example, and giving them high doses of vitamin C increased or gave them more stones. I have not seen that be the case clinically. However, what I would suggest, if you're worried about it, is have your oxalate. There's a test you can have done, a 24-hour urine oxalate test. Have your doctor run it. If it's high, now you need to start asking different questions, and whether or not it's vitamin C is not going to necessarily play a role in that, but you might need to diversify your gut microbiome, because a lot of people with high levels of oxalate, there's a type of bacteria called oxalobacter, and so if you've taken antibiotics, a lot of times we'll see it destroys the good bacteria that help you break oxalate down from your food. And some people do better on a lower oxalate diet, so they not necessarily a no oxalate diet, but reduce their oxalate intake or reduce foods that have the highest oxalate content as a general measure to try to reduce the risk for developing stones. But vitamin C, in my experience, is not something that I would say contributes to the formation of kidney stones. Gluten in shampoo can be. You got to read the label and make sure you check it out. Okay. So we got lots more questions, but not lots more time. And since I am on about 4 hours sleep today, I'm going to go home and I'm going to get some sleep so that I can come back next week strong and fresh for you. Thanks for tuning in with me this Monday evening for our Halloween Spooky Gluten Spectacular Special. Look, if you think this information can help somebody else, you got to know our mission. It's to save 100 million lives. So don't be stingy with it. Make sure you hit the share button. Make sure you hit the like button. We're highly censored these days, so we're being shadow banned. So the more you can share, the more those social media algorithms get broken down, and the more this information gets into the hands of the people that need it the most. So help me share this information. Help me get it out there. I appreciate you. And if you're not subscribed, come over to glutenfreesociety.org. Make sure you sign up for our newsletter there. It's the one place that I can ensure you won't get censored is if you're on my newsletter. So make sure you make a point of doing that. Until next Monday, I hope you have a fantastic week and a happy Halloween and a great evening. Take care. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.